Were there any questions for Dr. Hospedales? No, sorry. Oh, there's a question. Okay, do we have a microphone that we can run? Sorry, we're going to get the microphone, I think. Do I see it coming? Hold on, we're recording the session, so we don't want people to miss the question on the recording. There.
Thank you very much for that informative presentation, Dr. Hospedales. I was just wondering if you would comment on the status of depressive disorders as being included in NCDs.
Thank you. There was a lot of discussion and debate about the inclusion of mental health issues or not in what was defined as NCDs by WHO, which are cardiovascular, cancer, diabetes, and chronic obstructive airways disease. And a lot of disappointment on the part of people in the mental health community that it was not explicitly included. I think operationally, it has to be included. Depression and alcohol are two mental health issues that intersect a lot with both cause and effect where NCDs are concerned. So from the CARFA point of view, we certainly see the connection, see the need for both primary prevention and screening using simple instruments in primary health care for the diagnosis and treatment of depression as being very synergistic with tackling the NCD problem. If people are depressed, they don't take their medicines. If they've got diabetic amputation or chronic renal failure, they're more likely to be depressed. And so you really have to look at it from a holistic point of view, not just physical health, but physical and mental. Thank you.
Any other questions? Okay, well, no?
Somebody here.
Yes, Dr. Hospedales. I'm looking straight at BAF's affordable health insurance, but I was quite interesting. I thought that the health context for action is quite interesting, but I didn't see anything on health insurance. Is there a possibility that that will be addressed in there under the health context for action?
Yes, I didn't focus a lot on that. Health insurance as part of universal health coverage to both help prevent things, to allow people care when they're affected, and to minimize economic catastrophe is a priority going forward for the region. A lot of countries have embarked individually on national health insurance schemes. Last week at the meeting of the Organization of Eastern Caribbean States, their health ministers considered a paper on the way forward. And what seems to be evolving is we have not been able, there's been studies going on for about 10 or 15 years on a regional health insurance, and we haven't managed to pull that off. But a lot of countries are on different, are on the road to national health insurance. And the thinking now seems to be that these can all be rolled up or joined up, and you can get some efficiencies by joining them together. Certainly in the Eastern Caribbean, which is a single economic space with monetary union, that is a distinct possibility. I haven't focused as much on it because health insurance focuses a lot on provision of care for individuals, which is an appropriate public policy goal. I have focused more on the public health goods and how do we finance those, because health insurance doesn't finance surveillance or health education or public policies that are going to improve health. And it's a challenge how we actually finance those. We're not and I'm putting the last chapter of my public life to focus on that. We're having a meeting early next year on how we can look at things like a micro-tax on incoming travelers for health, for security and environment, financing regional work. That is a big challenge.
Any other questions? Okay, can I get another round of applause, please, for Dr. Hospedales?